Are you struggling with ulcerative colitis and want to know what your options are? I'm Alexis, I'm an ER nurse, and this over here is Oakley. He's the true health expert in the room. If you're looking at biomedicine or Western medicine, your typical options that your doctor is going to talk to you about would be using antibiotics for bad flare-ups. They're going to want you to use likely corticosteroids, and they may want you to use immunomodulators to curb the attack that your immune system is having on your colon. And if your ulcerative colitis is severe enough, your doctor may even recommend surgery to remove part of the colon. Diet-wise though, of course, we all have to be eating all the time, so we can typically make improvements in our health conditions by just changing up the food that we eat. With ulcerative colitis, it's really important to eat soft, bland food. So foods with a lot of spice, fiber, dairy, etc. tend to make everything much worse. Essentially, you just need to buy some time for your colon to heal. Some natural medicine options for ulcerative colitis would be things like herbs and moxibustion that an acupuncturist would use. They could use moxibustion on you and prescribe herbs. So moxibustion just involves a little herb stick that heats up on one end, and they will use that over your belly. It is going to bring some nourishing warmth. And then supplement wise, a lot of doctors will prescribe fish oil, probiotics, and NAC, which are all going to help decrease inflammation. Ulcerative colitis is definitely not uncommon. I remember having a patient in the ER. She came in with a lot of mucousy blood in the stool. I mean, a lot. Like, I even had to help her to the bathroom, and I went in there myself and looked at it, and I was like, wow, she is definitely not lying when she was describing what it looked like. The doctor had ordered her a CT scan and she had blood work done. He basically just told her, hey, you have ulcerative colitis, here's an antibiotic prescription. And then I went in there and discussed diet with her, telling her to eat the soft, bland foods and cutting out everything else, just keeping it really mellow so that she could actually have time to heal. And the issue is you really want to give yourself time to heal after something like this has happened to you, because you're going to be a lot more susceptible to it happening again. So the better recovery that you give yourself the first time, the less likely that you'll have to deal with it in severity in the future. And then another little story, my husband never got diagnosed with ulcerative colitis. I don't know if it was ulcerative colitis specifically, but it was definitely colitis where his intestines were inflamed, because that can happen to you after you've had a stomach bug where your intestines just stay inflamed and it takes a while longer to get things to calm down. But he had in his head that recovering from the stomach bug, he needed to eat lots of berries, that was the healthy thing he needed to do. And, you know, good for him for trying to think ahead and choosing what would normally be a really great food to eat. But he didn't realize that he had that inflammation in his intestines going on, and he kept eating these berries for every meal. That was pretty much the only thing that he was eating. And berries are one of the worst things that you can eat if you have colitis, because they're going to be very irritating and difficult to digest, and they're going to make things worse. So he could not figure out why he kept having so much pain for days after recovering from sickness. And turns out that was why. If you battle ulcerative colitis regularly, then you're at risk for malnutrition. That's one of the biggest issues to worry about, because your body is not going to be able to absorb the nutrients properly. So just make sure that you pay attention to what causes you to have flare-ups if you are someone that has this issue regularly. So pay attention to the food that you're eating, your stress level, etc., and do your best to stay away from those things. I hope all of this information helps you in your own path. I'll see you next time.